That was a stopgap measure. That was an emergency measure. The fight has always been against the tobacco industry and always been about denormalizing tobacco.
In today's episode, we explore how one team is making strides to enact policies to help end the commercial tobacco epidemic in California.
Who's got the power?
I just want them to stop targeting us.
Cotton candy.
What do you mean it ain't flavor?
My father died of smoking-related illness.
Change in this country has always been a result of people speaking up against injustices.
Welcome to Take 10 to Take Down Big Tobacco. This podcast was created by the California Tobacco Endgame Center for Organizing and Engagement, a project of the American Heart Association, and is designed for the local health heroes and coalitions taking on big tobacco. In this podcast, we set aside 10 minutes to hear how those in the organizing community are working to end the tobacco epidemic. I'm Shannon Lujan, and thanks for joining. Welcome to today's episode. We're thrilled to have Nathan Subramanian from Alameda County's Tobacco Control Program to discuss their efforts leading a tobacco endgame initiative. Thank you, Nathan, for being here to talk about this exciting work. This really is about shifting the conversation to end the commercial tobacco epidemic. And it's also about preparing and transitioning communities. And for this work, they have to be actively involved in the process and be on board. So, Nathan, can you share the process you and your team used to select a jurisdiction for an endgame campaign?
Yeah, that's a great question. Great place to begin. And I appreciate that introduction of really the community readiness aspect. So I think when we think about flavors bans through tobacco retail licensing ordinances, I never really thought, hey, this place is more important than this place. It was just kind of like, hey, we want them all to have it. With this endgame policy, and to clarify, the policy that we're pursuing is an end to the sale of all commercial tobacco products. We realized that while we'd love this to happen everywhere all at once, that just simply wasn't going to be feasible, and that certain cities were going to be a lot better poised for this type of policy. So we met with our coalition, the Alameda County Tobacco Control Coalition, and we came up with a set of considerations that gave us a framework and gave us different indicators by which we could assess community readiness. So there was probably like 15 to 20 of them. Some kind of a high level overview was that, overarching, we wanted to consider equity just given the variety of sizes, of populations, of relationships with tobacco use prevalence, tobacco sales prevalence. It was kind of an overarching theme, but within that, some of the more practical measures were just the prior adoption of a strong TRL.
Just for our listeners, TRL being tobacco retail license.
Yeah. Not all jurisdictions in our county had TRLs. So, while there were some jurisdictions where I thought it'd be a great jurisdiction to pilot this in, they had not yet adopted that licensing structure. The counterpart to that was, if they had a TRL, how is enforcement going? And then I'd say the counterpart to that, because often the two are quite dependent, is how many retailers does the city have relative to the enforcement capacity? So I guess all of those things also tie back to political will. Is the city council willing to prioritize that rather than just have something on the books because it looks good or it looks bad for them not to, kind of thing. And then beyond that, really just community awareness and support, looking at things like, does the city have a lot of educational opportunities? Do they do health fairs? Are there cities that we've been doing a lot of work in to educate community members? What sense do we have from them that the community would be ready for this kind of thing? I will say that we didn't rule anybody out entirely, but we created basically a roadmap of early, mid, and late adopters of this type of policy.
We categorized them based on early, mid, late adopters, and then you really utilized the data that you gathered, and you're able to see which of these communities will the end game most likely be successful in based on their current priorities, based on their history, the strength of the TRL, the strength of the enforcement, and how aware and how passionate is the community for such policies. But you mentioned something earlier about equity. You brought that up. Could you explain the importance of equity in your framework?
I will say for me, it's kind of the elephant in the room, choosing Albany as a pilot jurisdiction. And we're trying to serve communities that are underserved. We're trying to reduce disparities between communities that have poor health outcomes. So
Mm.
it's not the number one choice if we were looking from an equity perspective. That
Okay.
said, we didn't want to focus on cities that we knew, through our conversations with enforcement, through our surveying of stores, et cetera, that we knew were having trouble with compliance, with implementing their TRL policy. So while from an equity perspective, there are many other cities that could benefit more from reducing the prevalence of tobacco products, let's figure this out in a place where we can afford to do that.
That's a good point, too, because when you're able to have success in one area, sometimes that's contagious, right?
Exactly. Yeah. In the city that we chose, Albany is next door to the city of Berkeley, which it has its own public health department and independently is pursuing its own endgame policy. And so we thought, hey, you know what? This is poised to become a regional thing if we're able to do this successfully in both jurisdictions. And then Berkeley neighbors Oakland. So then the next step would be moving in that direction
Mm.
naturally. So that's another reason we were like, let's try to circumvent just jumping straight into the deep end with this, try to figure it out, kind of have that cushion of Berkeley, and then work that way towards the rest of the county.
So then what sort of challenges or opportunities does your team encounter when pursuing this sort of initiative?
So, people joke that the city of Albany is like a school district surrounded by a city. It's got one high school, it's got one middle school. I grew up in the district right outside Albany, and so people like try to get their kids into Albany schools. So it's a city that's really well known, especially in the kind of this area of the East Bay for being for just really prioritizing the health and safety of youth. And so that, I think, for us was a huge opportunity. So, for instance, like their high school and middle school both have strong tobacco use prevention education programs that we knew were involved with their TRL. And so having that opportunity, especially through their 2P programs where they have strong, consistent groups of peer educators, I'd say that's the biggest
Mm.
opportunity. I mean, being able to collaborate with them for now the third academic year has been tremendous. I mean, they've
Mhm.
really been able to find their voices in this, and I would say be true leaders kind of independently of me. I provide a sense of guidance, but they are really
Mhm.
willing to get out and message kind of from their hearts and from their own perspectives.
And that really speaks volumes to the type of community engagement strategies that your team has done to build those effective local partnerships. Tell us a little bit about those strategies. What has proven effective and how important has been that community engagement?
Well, it's been tremendously important because just going back to even why that would be, when we think about flavors policies and going, city to city doing TRLs, I think it's a lot easier for someone to come from this distant entity of the public health department and be like, hey, this is a big issue. Like, let's show you some data. Here's a policy solution that's vetted by the state. Look at all the other cities doing that. We don't have that with Endgame. With ending tobacco sales, this is a paradigm shifting policy. This is like a trailblazing policy. So it's not just kind of like holding up the horror of the vaping situations on the school campuses
Mhm.
and then proposing a solution to it. It's moving beyond that, right? And so
It's
without
a mind
actual
shift.
buy-in, it's a mind shift, right? Yeah, you
Yeah.
talk to people. I mean, I've been in these rooms of people that are all for youth health and the protection of youth and students not vaping, et cetera. And then when you talk about any tobacco sales, you just watch their faces go blank. You know what I mean? And
Mm,
I
yeah.
think I probably felt the same way when someone said it to me, even after however many years I've been working for tobacco control. It's just something, it's so normal. And so therefore it becomes hard to envision a world without it, and that's the big issue. So anyway, those local partnerships have been huge, both in just building a local coalition of support, but also shaping the direction and the messaging that this campaign's taken. So Albany is known for its great street fairs,
Mm,
um, and so we've been trying to be present at that as much as possible,
okay.
meeting people, re-engaging people, providing accessible options for participation. So creating materials where they can take it home. And even if they don't want to like sign something right then and there's an option for them to easily, let's say, scan a QR code and send an email to city council. But I think, yeah, the strategy for us is just being
That
being
is, yeah.
present. Yeah, being
Absolutely. And I hear you're going to them, right?
for
And
sure.
I think that sometimes a misconception is that, hey, if you build it, they will come. That's not the case. In this case, you're finding out what are the events that are going on in the community. And then your team is going to those events. You're showing up, you're giving them the resources, you're giving them the tools, and then you're making sure their voices are heard and guiding this discussion and how you're going to move forward as a community.
We've also been doing regular public comment. So things haven't really been on agendas, but when students or other community members want to speak out on this, it brings people in. And we found other great allies just through doing public comment and then connecting with them at the meeting or hearing them speak about it and then reaching out. So I think linking up with non-traditional partners, this is a big, again, it's a paradigm shift. It's not just a tobacco control thing. This is a community thing. I think we really need to broaden and reframe this as a paradigm shift and just a denormalization of tobacco and getting the industry out of our cities. I think it's just this whole thing has been a process of figuring out what our messaging is. It's a lot less straightforward than with flavors.
Again, building and leveraging key relationships along with strong community engagement strategies is essential to informing the process. Now, I imagine some listeners are curious about how they can begin pursuing similar policies in their own communities to help end the commercial tobacco epidemic. What strategies can tobacco prevention advocates and coalitions do to move in this direction?
I would say broadening the framing, focusing on the industry, framing this as a consumer protections issue. I think it feels compelling that if we as a city, even if we say, yeah, you shouldn't use it, yeah, we need good enforcement, X, Y, or Z, if we're okay with tobacco being sold, given that we know when adult smokers really begin trying these products for the first times, then we're okay with youth being addicted. Yeah. We're okay with the industry continuing to be a normalized presence in our lives. And we're okay with what's happening, continuing to happen. You'll sit in a room and ask people, hey, do you support smoking? Do you support, the sale of these products? Do you support this or that? And they'll say, no. But when you propose that, well, then we shouldn't sell these products anymore, people tend to get caught up on that. And I think we really need to have that broader vision that's always been the goal, right? I mean, it's the fight against big tobacco is just that, right? Like the prevalence, the rise of vaping and the prevalence of that over the past 5 to 8 years is crazy. I mean, it's blown the doors off all the, the incremental progress of weaning society off of cigarettes. And so those flavor bans, for anybody who turns around and says, well, what about this? We already did all this. Is that even working? My response would be, hey, that was a stopgap measure. That was an emergency measure. The fight has always been against the tobacco industry and always been about denormalizing tobacco.
Thank you so much, Nathan, for being here and sharing your insights. For more information about this subject and other advocacy resources, go to organizingtoendtobacco.org. And don't forget to follow us on social media. I hope you found this discussion insightful and enjoyed our exploration of today's topic. If you have any questions or comments, please reach out to us through our website or social media channels, and be sure to share this podcast with your friends and colleagues. Until next time, thanks for joining. This program is copyright of the California Tobacco and Game Center for Organizing and Engagement, a project of the American Heart Association, with funding from the California Tobacco Prevention Program. The opinions expressed by the speakers in this podcast are their own and not necessarily those of the Tobacco and Game Center, California Tobacco Prevention Program, or the American Heart Association. For more information, visit organizingtoendtobacco.org.